And we did tell you that we're here to give you comprehensive coverage. And of course, following that extensive coverage on the disinfection exercise that was undertaken by the Ministry of Local Government in coordination with the various MMDAs, you know that this is what we need to give you the latest update. And we'll start from the Ghana Health Service portal. And it's where by the evening of 8 and 28, we got to know that the post of the Ghana Health Service indicated that we had recorded an additional death apart from the first one that was initially recorded. It brings to the number of confirmed cases to 27, but the existing ones are 25. And many of you could also get access to that portal, GhanaHealthService.org/COVID-19. Better still, you can go to myjoyonline.com, get all the latest updates as it is. But look, this is just the Ghana situation. We'll take you to the world situation where you also get to know what really is happening. And this currently is the global situation as we have it. We have a total confirmed case or cases numbering 381,620 and above. It keeps rising. But look, China, which had recorded in excess of 80,000 cases over the last month, seemed to have slowed its case reporting as well as the fatalities that have been reported. And so outside China, outside Asia, we have Italy, which seems to be the dominant force as we have it, because you can see that the cases are just increasing. So far, we have 6,077 deaths in Italy alone. And even though we had the Hubei province, that is Wuhan being the epicenter, and that city of some 11 million people, where we had the initial trickling in of the cases, and then many of them started getting imported out or exported out of Wuhan. There are great indications that a number of deaths have since been recorded. And so Italy is topping with 6,077 deaths and 3,160 deaths in Hubei, China alone. Spain is reporting 2,300 cases of the deaths as we have it, 1,800 for Iran, 860 for France, and then the United Kingdom is reporting 335 cases. The United Kingdom. Now, outside the United Kingdom, we have the Netherlands following through with some 213 cases, and then in New York City alone, we have 125 deaths. Germany, though, if we go back to Europe, is reporting 123 deaths, followed by South Korea, because you would know, the South Korea situation is quite interesting. When the initial cases were being reported in China, and then subsequently Iran took over, before we'll get to Italy, South Korea became an epicenter of a sort, because we had many of the religious groupings, especially the Christian churches, many of them not adhering to the protocols as they were at the time, but subsequently the government had a firm grip on the situation, and so that's why they had these number of cases. But it still means that they still follow through because of the number of deaths so far and the confirmed cases. So you have China, Italy, the United States, Spain, Germany, Iran, France, and then you come to South Korea. But down the ladder, we do have Israel, and then you have the subsequent ones. You go to Latin America or South America. Ecuador is also well registered there, and then you have Luxembourg, Pakistan, Thailand, Poland, Chile, and then of course you have Finland, Greece, Iceland, and Indonesia. Well, we all need the grace of God. But apart from the grace of God, we keep educating you and telling you right here, not only on the show, but the rest of the programming on JoyNews, that we need to make sure as a people we stay glued to what the guidelines are from not only the World Health Organization, but also the Ghana Health Service. And this is a situation as it is. All the red spots are the cases. They also include the fatalities or the deaths as they are. And you can see that North America now has been widely affected by the disease. You can see a lot of the red spots, and it's dominating in many of the states in the United States of America, because you know North America is made up of not only the United States but also Canada and one or two other places. So you get to find that you go to Philadelphia and then also New York. New York seems to be one of the highest places where you can get many of the cases recorded as well. You go to Detroit, a lot of the black community in there as well. You have a lot of the cases being reported, and then Chicago. Just around some of the extensive stretches leading to Milwaukee, you also get to find that. But you come down south and you come to the coast, you have New Orleans and Louisiana, many of them reported, and then you go down south towards the coast also, these things, because you have Miami and Tampa Bay, and many of them also reported many of the cases. But it is in California. You go to Los Angeles, you know, the center for Hollywood, where many of these films are produced. The big film producers are there. You have a number of cases there. They've had a number of fatalities also recorded within the period. But it shows how devastating the disease has been for even some of the top most developed countries, if not all the developed countries across the world. So how much less us, so to speak. That is why the decision taken by the president to make sure that we undertook these restrictions following that bill that was also taken to Parliament, leading to a law being passed, it looked like one of the bad decisions that the Akufo-Addo administration has taken. What we need to do is to make sure that we adhere to the protocols as, again, communicated by the World Health Organization and then also the Ghana Health Service as it is. Look, that's where we have to do the newspapers. But this is the situation. Australia recording cases. Let's go. You also get to have a number of cases also being reported, apart from Europe. You have Australia, you have a number of the North Pacific countries as well. But it speaks to what the records are. And you can get all the latest as we have it. And this is compiled by the Center for System Science and Engineering of the Johns Hopkins University. Johns Hopkins University.